Imagine this. It is 6:30 in the morning. The coffee is not even brewed yet. You walk into the living room and you see your senior dog lying there, awake, watching you, but not moving, not stretching, not trotting over the way they used to.
Oh.
You call their name and they lift their head, wag their tail twice, and just stay put. Then you hear it. That soft groan as they finally push themselves up onto stiff legs. I know exactly how heartbreaking that sound is. You watch the dog who used to spin in circles at the sight of their leash now take 30 seconds just to stand up straight, and it is not just emotional, it is expensive too. $80 for an anti-inflammatory prescription here? $120 for a joint supplement that barely moves the needle there. Hours spent Googling why is my senior dog so stiff in the morning at midnight while they sleep beside you, and what is worse. No matter what you try, the stiffness always seems to come right back the next morning. But what if I told you that the biggest factor in your senior dog's mobility has almost nothing to do with what happens on your evening walk, and almost everything to do with the first 10 minutes after they wake up? What if I told you the secret is not a supplement, not a prescription, and not even a trip to the vet? It is a routine. A specific sequence of things you do with your dog in the first 10 minutes of their day before their joints have had a chance to fully warm up. Today I'm going to show you exactly what that morning routine looks like, step by step, so your senior dog can start moving like themselves again.
Hi.
Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be. Using simple, vet-approved routines you can do at home with things you already have. Before we dive in, I need you to drop the guilt. You are not a bad pet parent because your senior dog is slowed down. Aging joints happen to every dog, no matter how well you have cared for them. In fact, the very fact that you are watching this video right now, at this hour, looking for a real answer, proves how much you care. That already puts you ahead of most pet parents out there. I actually posted a video a few weeks ago on the 3 human foods that quietly wreck senior joint health, which I will link at the end, so keep this one in mind for later. So today we are doing a complete masterclass on the senior dog morning routine. Grab a notebook, because I am about to give you 5 proven steps to get your older dog moving comfortably again, starting tomorrow morning. Let's get into it. Chapter 1. I call this one the furnace method, and almost no one does this correctly. Most owners think the fix for morning stiffness is just get them moving. Walk them, they say. It'll loosen up. But here's what's truly fascinating. Forcing a cold, stiff joint to bear weight before it is warmed up is a little like sprinting on a cold engine. It is not just about movement. It is about temperature. Synovial fluid, the natural lubricant inside your dog's joints, thickens overnight while they are still and cool. Thick fluid means more friction, and more friction means more pain with every single step. So before your dog takes one single stride toward the door, we warm the joint from the outside in. Take a hand towel, run it under warm water, not hot, warm, wring it out, or gently hold it against your dog's hips and elbows for 60 to 90 seconds each while they are still lying down. You will actually feel them relax into it. Now, here's a quick warning. Never use a towel that is hot enough to be uncomfortable on your own wrist, and never apply heat directly to an open wound, a hot spot, or an area that is already swollen and inflamed, since heat can worsen active inflammation. If your dog flinches away from the warmth instead of leaning into it, stop and call your vet, since that can be a sign of something more serious than simple stiffness. Chapter 2 is one of my personal favorites, and it takes less than 90 seconds. It's not stretching, it's passive range of motion. Let me guess, you're probably thinking, stretching a dog sounds complicated, maybe even something only a physical therapist should do. But this is different. While your dog is still lying on their side after the towel treatment, gently and slowly take one back paw in your hand and move the leg through a slow, small bicycle pedal motion, 3 to 5 rotations, then switch to the other side. You are not forcing anything. You are simply reminding the joint and the surrounding muscle where its full range of motion actually is, which studies in canine rehabilitation have shown can meaningfully reduce stiffness-related guarding behavior. Stick with me here because this part is important. If at any point your dog tenses up, pulls away, or yelps, stop immediately. This is not a sign to push through it. That is your dog telling you something hurts, and that is a conversation for your veterinarian, not for a home routine. Chapter 3. And this is where we bring in something from your pantry that most owners completely overlook. It's not turmeric. It's not fish oil either, although we will talk about fish oil later as part of the foundation. This is curcumin delivered through a warm, absorbable paste, and the mechanism matters here. Curcumin on its own is very poorly absorbed by the body. But when you combine a small amount of turmeric with a fat source and a touch of black pepper, the piperine in the pepper increases absorption dramatically in some studies by over 1,000%. To make it, mix 1/4 teaspoon of turmeric powder, 1 teaspoon of coconut oil, and a tiny pinch, less than what would fit on your fingernail of black pepper, into a small paste. Mix this into their breakfast, not as a standalone treat. Here's a quick warning. Turmeric can act as a mild blood thinner, so if your dog is already on prescription blood thinning medication or is scheduled for surgery, skip this one and talk to your vet first. And always start with a smaller amount than this for the first few days to watch for any stomach upset. Chapter 4 is my personal favorite because it costs you nothing and takes 10 seconds. It's not just walking on a leash, it's walking on the right surface. Most owners walk their senior dogs straight out onto pavement or hardwood floors first thing in the morning. And that hard, unforgiving surface sends a jolt through every stiff joint with each step. Instead, for the first 5 minutes of movement each morning, walk your dog on grass, a rubber-backed rug, or a yoga mat if you're indoors. The slight give in these surfaces absorbs impact the way a hard floor cannot, which is especially important for dogs with early arthritis in the hips or elbows. If you have hardwood or tile floors at home, this is also why so many senior dogs slip and struggle to get up in the first place. So consider adding non-slip runners along their main walking paths. Chapter 5, and I promise you this one surprises almost every single owner. It's not more exercise. It's the 5-minute rule. Most owners think longer walks are always better for a stiff senior dog. But what if I told you that overexertion in the first movement window of the day can actually cause a flare-up that leaves your dog worse by the afternoon? The rule is simple. The first walk of the day, right after the towel and the paw rotations, should be 5 minutes, no more. Slow, easy. Let your dog set the pace and let them sniff as much as they want, since sniffing is genuinely calming for their nervous system. Save the longer, more active walk for later in the day, once their joints have had hours to fully loosen up. Now, here's a quick warning. If your dog is limping, favoring one leg consistently, or seems reluctant to walk at all, even after this gentle routine, that is not something to push through with more walking. That needs a veterinary exam. Chapter 6, and this is the one I consider the foundation everything else sits on. It's not a trick or a hidden secret. It's fish oil. But the timing and the dose matter more than most owners realize. Omega-3 fatty acids, specifically EPA and DHA, work slowly in the background to reduce the overall inflammatory load in your dog's joints, which means the towel, the stretching, and the turmeric all work better on top of it. As a general starting point, many veterinarians recommend somewhere in the range of 100 to 150 milligrams of combined EPA and DHA per 10 pounds of body weight daily. But this can vary based on your dog's size, health history, and any medications they are already on. So please confirm the exact dose with your own vet before starting. Give it with breakfast, not on an empty stomach. Since fish oil taken alone can occasionally cause loose stool in sensitive dogs, now here's a quick warning. Fish oil can also have a mild blood-thinning effect, so if you are already using the turmeric paste from Chapter 3, or if your dog is on any other blood-thinning medication, talk to your vet about the combined dose before layering these together. I also want to take a moment on something that trips up a lot of well-meaning pet parents, which is human food. In the excitement of building a new routine, some owners start reaching into the fridge for healthy extras. A few human foods are genuinely safe in small amounts for most dogs. Things like plain cooked pumpkin, plain cooked sweet potato, and small pieces of blueberry, which all offer gentle anti-inflammatory support. But please keep grapes, raisins, onions, garlic, and anything containing xylitol completely out of reach, since even small amounts of these can be seriously toxic to dogs. When in doubt about a specific food, a quick call to your vet is always worth it. Now please listen closely because this is a massive veterinary warning, and I want you to actually pay attention here, not just nod along. Everything I have described today is designed for general morning stiffness that comes with normal aging, kind almost every senior dog experiences to some degree. It is not designed to treat, mask, or replace veterinary care for serious conditions like advanced arthritis, hip dysplasia, cruciate ligament injuries, or spinal issues. If your dog's stiffness does not improve within 7 to 10 days of this routine, if it is getting worse instead of better, if you notice sudden lameness, crying out in pain, or a complete refusal to put weight on a leg, please call your vet immediately. Home routines are a wonderful complement to veterinary care. They are never a substitute for it, especially in a dog whose body is already changing with age. Here's the golden rule, and I want you to really hear this, because I know that list of 5 things probably feels like a lot. You do not need to use every single one of these every single day. Daily, do the warm towel and the passive range of motion. Since these two take under 3 minutes combined and set the tone for the entire day, 2 to 3 times a week, add the turmeric paste to breakfast. As needed, especially on cold or rainy mornings when you notice extra stiffness, add the soft surface walk and the 5-minute rule. The whole process, even on days you are doing everything, should take you no more than 10 minutes. Watching your senior dog slow down is one of the hardest parts of being a pet parent because it is a quiet, daily reminder that time moves forward for them faster than it does for us. But by choosing to educate yourself, by choosing to take just 10 minutes out of your morning, are proving how much you truly love your dog. You are giving them more comfortable years, more tail wags at the door, more slow, happy sniffs on the sidewalk. And that makes you an incredible pet parent. If this video gave you hope today, please hit that like button. Genuinely helps more senior dog parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. And please leave a comment telling me, what time of day is your senior dog's stiffness the worst? Morning, after naps, or after long walks? I read every single one, and it actually helps me plan future videos around what you're all dealing with. Give your sweet, beautiful old dog a gentle scratch behind the ears for Dr. Marcus tonight. I'll see you in the next one.